All right, today we have Layla Jane with us to discuss her transition and detransition story and some of the other things she's got going on in her life. Layla, thanks for joining us today.
Thank you for having me on.
Yeah, no problem. Uh, is there like if we can just kind of maybe start out like at the beginning, if you will, like about how old were you when you started having thoughts that maybe you weren't in the right body or something wasn't quite right?
So, I mean, I was always a bit of a tomboy growing up as a kid, but nothing outside of the realm that would be atypical for a girl. But I hit puberty really young. I was about 9 years old, and it was really difficult on me. I started getting bullied because I went through puberty before the other girls did, and the changes were just really quick and really just out of nowhere. It felt like. Also, doesn't help that I got diagnosed with autism at age 18. Um, so, in hindsight, I could have been struggling with the changes for that reason as well. Um, my mental health was also starting to get a little bit bad there. So by age 11, I learned about transgenderism. Like I kind of knew about like transvestites, like jokes in media and TV and movies, but I didn't know about transgenderism, especially as it relates from female to male being a thing. And at 11, I learned about that, and I was really interested and kind of like fascinated, and learned as much as I could. I have unfettered internet access, and began to latch onto it for a reason, to explain the distress I was experiencing. My computer back, but I was seeing a therapist about that time, and I told her about these feelings I was having. She diagnosed me with gender dysphoria, but didn't tell my parents. Um, and this was at 11. Um, right before I turned 12, I told them and I came out. They didn't really know how to handle it, but they kind of assumed that it's similar to having like a gay child. And I got referred out by that one therapist to another therapist who also diagnosed me with gender dysphoria. This first therapist told me that I was past Tanner stage 2, I believe, too far in puberty for blockers, and gave me birth control pills to stop my menses because it was distressing at the time. My body didn't adjust really good to them. Like I was constantly throwing up, so I stopped them within a week. Complaints were made. Didn't see that first specialist again because she was supposed to be a transgender specialist. Went back to my original therapist, and then she referred me out to Oakland because I'm more in Central Valley. And Oakland was supposed to have more of a like qualified specialist with a lot more experience. They have their whole they call it the Proud Clinic. It's like they also refer to it as a multi-specialty transitions clinic. They handle pediatric patients. And the therapist there diagnosed me with gender dysphoria, and shortly thereafter, got me started on the Lupron. So I took that for about 6 months. I got a script for testosterone, and I started that in June of 2017. By September of 2017, it was a month after my 13th birthday, I had a double mastectomy. Um, and the double mastectomy, so I feel like I wasn't given a whole lot of information, or it just wasn't laid out as well as it should have been, even in reference to an adult patient. They use terms like chest feeding when discussing that I would never be able to breastfeed if I conceive a child. Um, and I was told that I would lose sensation, but I thought that equated to numbness. But Instead, I have a lot of like phantom, almost like a phantom limb sensation in my chest. Um, there's a lot of nerve pain, like pins, needles, like electrical zaps. And there's a lot of itchiness, but I can't really scratch it. Um, my skin doesn't really register that, like it registers the nerve pain. So I'll be scratching and scratching almost till I bleed, and it's not giving me any relief.
Jeez.
Yeah, it's and this is something that I am gonna have to deal with for pretty much the rest of my life. Reconstruction may help with some of that, um, but it's not fully known. Nobody can really say with certainty to what degree that's gonna alleviate those type of issues.
Right on.
Also, so I've had an ultrasound done over my chest, and I still have my mammary glands. I assume they would be completely torn out, but they're there, but they are severed. So if I were to conceive and start lactating, my body would start producing milk, but there would be no way for it to get out. So it would likely cause a really serious infection. Um, and so if I ever do plan to conceive a child, I need to get those taken out preemptively.
Wow. That would be a lot of so you'd have to have a lot of surgeries, and they wouldn't do it all in one, probably strip that out and then reconstruct.
Um, I'm not the best at explaining the specifics, but I definitely need at least 2 phases of surgery. One to because I do want implants because it just really affects my self-esteem and confidence. I can't like wear a lot of tops, or like when I go swimming, I just wear a t-shirt. Um, so I would need one procedure to, take out the glands and put implants in, assuming I don't need tissue expanders. And then, so not to get too graphic here, and feel free to cut me off if I am, but um, when the mastectomy was done, and this is common practice, they remove the nipples and resize them and move them to a more masculinized like positioning. So I would need to let the implants heal and settle, and then have another procedure to have them taken off and moved again. So it's going to be at least 2 phases.
That sounds pretty intense, to be honest. Not something that I would want to have to go through, probably.
Yeah, it's a little bit like nerve wracking, but
Yeah.
I'm willing to endure it to try to restore what I can. Of course, it's never going to be the same had I just been left alone, but um, yeah.
I hear you. If you don't mind me asking, like, what kind of thoughts were you having initially that started your process? Like, did you just
So
not? Oh, go ahead.
oh no, I I was really, and this is common for teenage girls in general going through puberty. Like I was just really uncomfortable and embarrassed of my body. I didn't like that I was starting to get really unwanted attention from other from boys and even older men. I really just wanted to hide and conceal everything. Um, and with the doctors going along and giving me the gender dysphoria diagnosis, um, I fully believe that I had a male brain but a female body, and that there is a incongruence there that explained my distress, and that was why I thought that this would be beneficial for me and ultimately benefit me in the long term, which it did not.
Right on. So then you're like, do you feel like the doctors were giving you great advice, or do you think they were just kind of pushing you in a certain direction?
I kind of feel like I was being pushed along in a certain direction. I had a lot of underlying mental health issues, like the autism. I have anxiety, and I have depression. I also had undiagnosed PTSD from a really young age. And nobody really dealt with the comorbidities. They kind of got, for the most part, ignored, and they just focused on the whole transition thing.
Do you feel like that's because they just don't have like maybe the right kind of help for what people like that would need, so they just push what they have?
Yeah, like I'm not really sure um, what the answer would be
Yeah.
entirely, besides to have a lot more quality therapy, more exploratory, um, just to make sure there's nothing comorbid going on, and make sure if there is, to have that under control completely first, before, because even going through social transition is a lot. Um, it can affect and strain relationships in certain ways, and how the world treats you, moving forward. It it makes things a lot different, and especially for a child, can be really difficult to navigate and cope with. So to add that on top of pre-existing issues is just asking for disaster, I feel like.
Right on. um do you want to talk at all about like maybe some of the side effects from like the hormones that you've taken, that like I know you mentioned I don't know if it was in one of your videos that you had like thickened vocal cords. That's not irreversible and stuff like that.
Yeah, so I'll start with the Lupron, the puberty blockers. I can't 100% say with certainty. However, I don't know what else would contribute to this, but I have a lot of hip pain, and joint issues that really affect my daily quality of life. And also, too, while I was on the Lupron, it was like going through menopause. I was having hot flashes to the point where I would open the freezer, and try to like stand in it to get some kind of relief. Um, of course, I'm over here trying to do like middle school homework, and that's making it so much more difficult. Um, so that's the main thing with the Lupron. With the testosterone, um, so yes, it did affect my voice. I do have a deeper voice now. I have a very slight Adam's apple. It's kind of hard to tell on camera, but I can feel it. My hair kind of started falling out for a minute there. It could also have to do with stress. I'm not entirely positive about that, but it is a likely correlation. Um, I also grow body hair in places that I didn't before, and I have a little bit of facial hair that I have to deal with, and try to keep at bay. Um, I have urinary issues, and issues related to atrophy, um, that are caused by taking, because I was on the testosterone for about 5 years, from 12 to 17. Um, and this is a really common issue that can develop, in women who take it, that really isn't talked about enough. Um, like, I don't want to get too graphic, but I have to go urinate really frequently. Um, and, I'll feel extreme urgency to go. And then there's not actually very much in my bladder, and it's also difficult to empty it out. Some people almost start to develop like almost full blown incontinence. Thankfully, I don't have that issue going on. Um, it also likely affected my fertility. Even now, doctors, because there's not enough research, can't tell me with certainty, about how my fertility has been affected. Um, but it is likely that it would be a lot harder for me to conceive, in the future, and I likely will need, some type of supplemental like help or something. Um, so those are the main ones I can think of off the top of my head. Um, I will say that for a period of time, I did have kind of a euphoria very briefly after I started the hormones and after my surgery date. Um, but after that, my mental health just took a really severe nosedive and got worse. Like I already had issues with self harm prior to taking hormones, and they worsened. Um, like I wasn't necessarily outwardly angry or aggressive to other people, like is a concern with the testosterone. I directed that inward. Um, like my methods of self harm changed and got a little bit worse whilst I was still taking them. Um, it was a very difficult time for sure.
How do you feel? Well, I guess can I ask? I don't know. If not, I can always cut it out. Are you homosexual then? I guess I don't know about.
No,
Okay.
that's fair. That's a fair question. Um, so I kind of have always leaned a little bit bi. However, I'm currently in a heterosexual relationship. Um, so if that answers.
Yeah, I guess I didn't really see that on your profile, but I know that you had went to the Pride Parade or whatever the other day. I seen that video or posts about that on X. So I wasn't sure if you were just like a ally of theirs or if you were homosexual. I know that the trans is involved in the community as well, but I, I guess I didn't know about that.
Yeah, so I'm a very staunch supporter of the LGB. I have plenty of homosexual friends in my life that I fully support. Um, my issue is with the T and the Q and the plus that's been tacked on, especially when it relates to children. I care a lot less when it comes to adults. I, for the most part, believe that anybody should be able to do what they want to do with their own body, just leave children out of it. However, with the outcomes that I've seen, even for adults, I don't fully support it. But I'm not going to go and attack the legislature as it relates to adults. Um, but I kind of see it as encouraging an anorexic to starve themselves, or, telling a drug addict to keep on using. I know it's not quite the same, but that's the best comparison I can think of. Like, of course, you wouldn't give an anorexic liposuction, and you wouldn't tell them that, oh, yes, you should do that to be your authentic self. Um, you would acknowledge that it's not good for their health.
Right on. I guess I do have one question, and I hope that it's not inappropriate. I feel like it could be misinterpreted as that, but I'm just trying to understand. And as someone that's not overly familiar with this lifestyle and stuff, I guess like I just kind of have natural questions when I'm thinking
That's understandable.
would it be fair to say that in a sense you felt like a boy, but when you became or when you were going to transition to male, would you have been considered a homosexual male? Would you have still
Um,
like went after men at that point? Or I mean, I
yeah.
go
So
ahead.
yeah, I would have been considered like a gay trans boy, for the most part. I mean, I did lean. I still lean bi, but I feel like taking testosterone made me more attracted to men than women. It kind of flipped my preference a little bit weirdly. Um, I'm not 100% sure why, but that's just what I experienced myself.
Yeah,
So yeah, for all intents and purposes, I would have been considered gay, even though it is biologically, technically heterosexual.
right. Um, maybe this is too personal. Were you planning on becoming full? Were you planning on getting the full on surgeries, or were you content with where you were in life? Did you feel?
So I was interested in it. However, thankfully, they at least don't do phalloplasty, at least at the time, until 18. But I also kind of wanted to wait for the technology and stuff to get better before undergoing it, was my thought process at the time. And yeah, so I'm very thankful for that, because phalloplasty is tough. It takes like somewhere between like up to 5 stages.
Jeez.
And multiple revisions are very common. And there's a lot of issues that can go wrong. A lot of people experience incontinence after these kind of genital surgeries. There's just so many complications. It's insane.
Right
But
on.
I was interested in it while I was a lot younger. I think I also kind of had a little bit of like envy, because men can go pee standing up outside on a bush or whatever. Like I can't do that. Like I had some envy going on.
Right on. Like, at what point in your life did you decide that maybe, for lack of a better term, had made a mistake and made the wrong choice with your lifestyle?
So it took me quite a while to come to terms with that. I kind of had like a sunk cost fallacy, and I doubled down for a while. But by 17, I kind of started to realize, like, no, this isn't. I don't want to live like this. Like I never felt comfortable entering men's spaces. Like I'm a very short person. I'm about 4'11". So if I would have stayed transitioned, I would have been much shorter. Like not very many men are that short. People would have either thought I had some type of like dwarfism or something, or they would have mistaken me for like a young teenage boy, despite me being an adult. And I if something were to happen, like another man were to try to pick a fight with me, I wouldn't have been able to defend myself. It would have been very unbalanced. So I kind of started to realize, like, and it just kind of felt like I was putting on an act or a front, like after a certain point, just to stay presenting as male. Like I'm still a fairly masculine person sometimes. Like I have masculine interests. I don't really like to do a lot of makeup. I don't always wear a lot of skirts and stuff. Like I like to be comfy and a little bit tactical about that. But I'm still a woman. And it just took me a lot of time to accept myself for that, and in spite of everything that I did to try to escape from it. But yeah, about 17, and then right after I turned 18 is when I told my parents finally. It felt like coming out of the closet again. It was really difficult and uncomfortable to do. And my parents struggled with that a bit, about reverting back to using female pronouns and a female name for me again, because they had gotten used to, using a male name and using he, him. They even still struggle a little bit to this day sometimes, but they do their best.
Yeah, I mean, as long as they're trying to support you with whatever is going on, that's the main thing, right?
Right.
Right on. Um, would you like, if there was someone sitting at home watching this, and they were thinking about going down this path, would you have any real message that you'd want to give them?
I would recommend to find a therapist, a good therapist that isn't ideologically captured and is very neutral on this issue. And we'll do a full, comprehensive, um, exploratory, a lot of interviewing about your background and such. Um, you know, and definitely be 100% open with them. Like if you have trauma, um, or what have it, that should be disclosed and explored and managed before deciding to undergo something like this. Um, I feel like trauma is a really big reason that female to males um, transition, or that are just being homosexual and, you know, not realizing fully that you could just be a really butch masculine woman and be gay, and there's nothing wrong with that. That's beautiful. That's amazing, you know. And same for vice versa. Like, you know, you homosexual man can be feminine, like pretty things, and that's perfectly fine. There's nothing wrong with that. And there's people that will love them for who they are. Um, you don't need to change your sex just to, you know. Um, so that's a big thing. I would, I would say.
Um, are you're a supporter of like an 18 age limit at least, or do you have an age limit that you would like to see?
Yeah. At least 18. I kind of would almost prefer 21. You know, because I'm just speaking to my experience right now, but I was allowed to permanently try to alter my sex before I could consent to have sex, before I could even drive a car and get a learner's permit, before I could get a tattoo, vote, drink a beer, buy cigarettes, any of that. And I don't feel like that's right, because these are a lot more permanent than, you know, a year or two of smoking. I mean, that's obviously not great either,
Right.
but you can quit, you can cut back, you can't undo the damage that hormones cause. That's something you have to live with for life.
Right.
Like even a tattoo, you could get it lasered off, you can get a cover up. There's options for that, but and they're a lot less invasive. Like if I ever wanted to have my voice fixed, you know, or they would need to cut open my neck and shave down the Adam's apple and shave down my vocal cords, and that one's just too invasive for me. I don't think I could do that. I'm okay living like this, and sometimes I do try to speak with a little bit higher of an inflection than is like my natural speaking voice to try to compensate, and I'm okay with doing that. Obviously I don't love it. It gets tiring and straining on my voice, but it's better than going under the knife and having a surgery in an area like that.
Yeah. Yeah, I agree with you there. Um, what's your relationship with the trans community at this point?
Um, Most of them hate me. You know, they don't really like having to hear from me. Um, it kind of probably messes with their worldview and their thing they got going on, which is fair. They really don't treat any kind of voice of dissent with kindness. You know, even though they're supposed to be the party of love and acceptance and tolerance, I've experienced nothing um, of that sort. You know, they'll try to silence me. Even at that event I went to, all my sign said is "No child is born in the wrong body." It shouldn't be that controversial. It's not like I held up a sign that said "Trans adults are disgusting" or something like that. Like
Right.
no, um, and I still had people flipping me off, screaming at me. I had a large trans woman in a blue floral dress dancing in front of me and trying to block my message. And of course, this person's a lot larger than me and towering over me. um, but I just kind of just said, "Excuse me," and just like scuttled to the side and held it up as high as I could with
Right.
the arm span I have. Um, so, yeah, you know, I get told that stuff along the lines that I'm hurting trans people when in reality I'm trying to protect people from becoming detransitioners like me later down the road.
Right.
Because this is just, it's complex. There's not a lot of research or science. Like, doctors don't entirely know how to handle me. They're scratching their heads, and even when I go to a GP, like, I'm having to explain to them, they already, first of all, barely understand the concept of transition. They've never heard of detransition. So I'm having to educate doctors here, when a patient shouldn't have to do that.
I hear you. I get it though. To be honest with you, until I stumbled upon like you and Aaron Kimberly and a few others, I had never really heard of it either. And to be honest with you, I had never thought someone would go back to their norm or to their birth body after doing all that stuff.
Yeah, I didn't even know about it when I was transitioning. My doctors never brought up the possibility of detransition one day. And I didn't even know that's what I was doing when I started, that there was a word for it when
Right.
I started kind of reverting back to presenting more female and not wanting to go by male pronouns anymore. I was really confused. I was like, I don't know, but this just doesn't feel right for me anymore. And I'm just really unhappy. So, yeah, I didn't even know as a patient.
Right on. Does the LGB community treat you pretty well, even though you're getting out of the T community?
Yeah, so there's a lot of LGB that definitely feels like the TQ should be separated. Um, Usually older gay people that support this, and they'll tell me stuff like, "Oh yeah, if I was born today, I would have fell into the same thing. I would have also um, probably been transitioned." Because I was a feminine man and I liked pretty things and I loved other boys, or I was a really masculine butch lady and I loved other ladies, um, they would have been mistaken for a trans kid um, in these days, and especially in states like California where um, they're very progressive, even though I don't see it that way. I feel like it's more of um, using regressive gender stereotypes to justify permanent medicalization for life, um, instead of just letting kids be. Like, I understand that distress can be very real, but they need help for that, not hormones, not surgery.
Yeah. If if you could speak to the parents of children who are going through maybe this, questioning their, I don't know if reality is the right word or not, what would that maybe be?
So, parents of a child who is trans identifying and such.
Or
Um,
yeah, go ahead. Yeah, questioning.
it's a little hard for me to speak on it because, of course, I'm not a parent.
Yeah,
I
right
haven't
on.
been in their shoes. I know it's got to be difficult, but definitely validate their distress. Don't undermine them, because that'll make them withdraw from the parent and seek validation and attention and love elsewhere. There's a lot of groomers in the TQ community that it's abhorrent, honestly. Um, Definitely, I would recommend keeping the kids off places like Discord and Reddit, because, like I said, a lot of unsafe adults lurk there. Um, I've seen posts on Reddit where, on the like trans forums, where a child will post and say, "Oh, my parents are unsupportive of this and that," and adults will swoop in and comment and message them with links to DIY hormones, which is insane to me. They'll buy these hormones and injection supplies online and do it behind their parents' back if they can, under the guidance of adults that have no relation to the child aren't medical professionals. So definitely get the kid in therapy, get them off places like Discord and Reddit, validate their distress, don't undermine it and be like, I understand that these feelings feel very real to you. And, get them help, get them a therapist that isn't just going to immediately affirm, definitely vet the therapist first. Get them, if they have trauma, get them good trauma-based therapy. If they are autistic, because I feel like autistic children are, and even adults are very susceptible to this. I can't really say exactly why, but, a lot of the detransitioners that I know, and I know a handful of them, more of them are on the spectrum than not. So definitely figure out if maybe autism or another factor like that is at play and get them whatever help is possible.
Right on. What was your video that you posted today about testifying? You want to talk about that at all?
Yeah, so I testified at the Sacramento Capitol yesterday. The number is slipping my brain right now, but I believe I testified
59
against
maybe
59 and 497. Let me double check here real quick. I don't want to misspeak. 59 is the video that I posted. So 59 basically makes it criminal to disclose somebody's sex assigned at birth if they try to change their gender marker, or to address them and post. I think it's more about like online posting to post their birth name, which I don't think should be a criminal act. Now, I do not support doxing. I don't support inciting violence or things of that nature, but I don't feel like it should be a crime to tell the truth. You know, it's especially when children are involved. I don't think it's a good idea. I don't.
Right. This is a question I guess I just thought of. Do you feel like if a person has transitioned, they should be morally or legally required to disclose that to their partners?
Oh yes, definitely. To a dating partner or a sexual partner, 100%. First of all, it's a major safety risk to not do that, and for them to just find out on the fly once they're behind closed doors, that's really not safe. But morally, it's just not okay. It's perverse and it's predatory. People have genital preferences, and there's nothing wrong with that. People should be entitled to have those preferences, and they should have mutual respect for their partner and disclose that up front, for those reasons.
Are you what about sports? What's your opinion on sports?
So I think they should either compete with their sex assigned at birth or make their own league. I would be completely okay with them starting their own inclusive league, and if people want to partake in that as opposed to the standard male female categories, then that's okay. So to circle back on the sports as I was talking about, I'm completely fine if they want to open their own category or if they want to compete with their biological sex. That's more than fair.
Right.
Because it's just objective, immutable fact that males have an athletic advantage in almost every category. I can't really think of one where they don't. Males have different. They have like wider wingspans and they're more height and such. So yeah, it's a shame that girls are losing scholarships that and their positions that they've rightfully spent years training for. I really don't believe that's fair. But if they their own category, they'll be fine. And if even um, regular natal females or natal males that present as such and haven't transitioned want to join those categories, then I feel like that's fair. Or if they want to keep it close to just trans athletes, that's kind of up to them. But it should be its own thing.
Right.
Like they deserve to play sports. They deserve to um, engage in those aspects of public life, but not at the expense of girls and women who have spent so many years training and are losing opportunities and such. So that's my opinion there.
Yeah, right on. Um, is there any real main things you want to? Is there any like important things you feel like you want to talk about?
Um, Trying to think right now. I feel like we've covered a lot here. Um, yeah, I don't have anything off the top of my head right now, but if you have any other questions you'd like to ask, feel free.
Right on. Uh, I guess like the main thing I would really want to know is like I guess if you could do it all over again, do you and you were like 12, 11, 12 years old, and you could tell that kid do it or don't do it, what do you think you would do?
I would definitely tell my younger self not to do it. I would tell her about where I've ended up now, essentially, um, and that it wasn't the right choice, and that she deserves to be loved for who she is and feel comfortable in her body, and that some of the things that happened prior were not okay, such as like the bullying. I had childhood sexual trauma occur. I would tell myself to get help for that. Keep seeing therapists. Maybe seek out a better one for sure. Um, I would tell myself that you're just on the spectrum most likely because I'm diagnosed now. And I'd tell myself to learn coping skills for that, and I would definitely give my younger self a major hug for sure.
I hear you. Um, there was something I seen that you posted on X that I was going to ask you about, but I can't remember what it was now. Um,
Um,
I guess maybe it might have been about the college. You had like a mutual friend that you went to the parade with, I think. Is she work at like UC Berkeley or something like that?
yeah, she worked at Davis.
Or UC
Um,
Davis, maybe.
yeah. Um, I am not as well versed as she would be.
Right.
But to my understanding, um, UC Davis is very ideologically captured. Um, they have pride flags everywhere. I guess for a minute outside of one of their LGBT clubs, they had a flag or a sign that either said death to detransitioners or detransition before death. I'm not 100% sure which one it is or was. Um, there's um, the insurance offered through them is also very affirming. I think they offer Kaiser insurance, and it's insane how quick they will um, write prescriptions for testosterone and surgery, especially for adults, but even for minors. And it's funny that people say, "Oh, this isn't happening. We aren't performing surgeries or giving minors under 16 hormones." It absolutely is. Like I lived it. I would know. Like I injected my own testosterone shots for a while. Like I'm very well versed in this. Like I'm not just some random lady.
Right.
In that regard. Um, I even had a lady at that Pride event I went to over the weekend um, tell me that I don't believe you. Like, this sounds really unbelievable. And I'm just like, ma'am, you can look up my name. Like, I'm not going to lift up my shirt and show you, of course. Like, that's a boundary that, no. But, there were trans men walking around with their shirts off. And I'm just like, I have the same scars as that person. I look the same. Like, you can tell by looking at me, I'm flat chested. And that's not natural for me. Um, so.
I hear you. Well, Layla, I appreciate you taking time out of your busy schedule to discuss such a personal issue with us.
Yeah, thank you for taking time as well and for having me on. I appreciate it.
Yeah, no problem. You have a good one.
You too. Thank you.
Thanks.
Bye.
Bye.